Good afternoon. This is Vivian Goodman, and I would like to call to order the Macon County Health Department Board of Health meeting for April 20th, 2021. And we have a roll call, please.
Paige Toth. Vivian Goodman.
Here.
Mary Jane Linton.
Here.
Phil Tibbs. Candace Clevenger. Jan Hack.
Here.
Dr. Druger.
Here.
Sue Krause. Dr. Meningati. Dr. Patterson. And Laura Zimmerman.
Here.
Okay, thank you. We have agenda topics. Brandy, was there anything that needed to be added or?
I would just like to add under new business, Board of Health appreciation. And of course, I know we can't vote to approve that, but there would be no vote or anything on that. It would just be discussion.
Okay. Okay, so since we're not able to vote on the agenda topics, I guess we can just move on to, is there any public comment?
There is not, there is no public present, and there was no public comment received via email either.
All right. And the minutes we're not able to vote on yet. Is there any communication?
We did receive some communication about property assessment. Because we do not own the building, I did forward that information on to the building commission, but I did want you all to know I did follow through with that. And other than that, just to provide our regular COVID-19 update to all of you. As you may have seen, some of the numbers and positivity rates are going up all over the place, including here in Macon County. Unfortunately, still the numbers are not, necessarily where they were at our worst of times, but it's still concerning. We're keeping a close eye on it. Our positivity rate is now up to 5.6%. For a while, it was at 2 or even under 2. And if you remember back in that October, November timeframe, it was, in 17 range. And so we're still significantly under that, but there's also less testing happening. So again, just something to keep an eye on. We did find out Thursday night that our county is now in the orange, which is warning level. That does not dictate like what phase we're in or what rules there are, capacity limits. That's just information for our county's residents to have for when they're making decisions about what they choose to do personally, or what their business may choose to do. As far as region, those regional metrics are the ones that guide the phases in the Restore Illinois plan. Region 6 that we are in is in the red for having 9 days of COVID patient increases. And I will tell you there are currently 4 variants in Macon County and 18 total cases that are variant cases. And we have a possible breakthrough case, which that would be someone that was vaccinated that end up being positive. There's several criteria that have to be met. It's still only possible, and it's 1 at this point. So when we get more information about that, we're just investigating to see if it meets criteria. So I just wanted to let you know that. And then the rest of the update I'll provide in department division reports. So that's all I have for communication, unless there's any questions.
Are there any questions for Brandy? Okay, moving on. Cherie, even though we can't approve, you want to go ahead with the financial report?
All right, so this report is through the end of March. So we were 33% into the fiscal year. The ending fund balance was $4,174,000. Total revenue was a little over $2 million, which is 26.6% into the budget, and total expenditures at $2.7 million, which is at 36.7%. And I will tell you that our revenue looks really low because accounts receivable hasn't been adjusted the last couple months because I'm waiting for audit adjustments to come through from the county auditors. So technically we have earned more revenue than what is being reported on here.
Okay. Anyone have any questions for Cherie? Okay, we'll move on to reviewing. We didn't get anyone else on yet, did we?
I think
You-
so. Do a
Okay.
double check here. Oh, wait.
This is
Sandy's
Janet
not-
Patterson. This is Janet Patterson. I'm here.
Oh,
No, sorry I was late.
that's okay. I'm glad that you jumped on. Sandy,
Yeah.
can you please record that Dr. Patterson, and it also looks like Candy Clevenger have joined the meeting, if you want to verify that and then record them as in attendance?
Yes.
Thank you.
Okay, awesome. So can we just move back up and approve the other items? Is that okay with you, Brandy?
Yes, I think that's fine. We just have to do a roll call for each of them because of the
Okay.
virtual setting.
So on approval of agenda topics, can we have a motion?
Brett,
Laura,
I
so
approve.
moved.
I'll do a second. Brett,
Thank you. And can we have a roll call vote, please?
Vivian Goodman,
Approve.
Mary Jane Linton,
Mary Jane, I think you were muted. We couldn't hear you. Sorry.
I'm sorry. Approved.
Candace Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Jerger,
approved.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approved.
Okay, thank you. That is approved. And then the next item would be approval of the minutes for March 16th, 2021. Can we have a motion to approve?
Brett, I'll approve.
And a second?
I'll second.
Thank you. Can we have a roll call vote, please?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Candace Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Jerger,
Approve.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approved.
Thank you. Motion carried. Okay.
Vivian,
I'm sorry, go ahead.
Vivian, this is Sue Kraus. I just got logged in, so I'm here too. Thank you. Approved.
Thank you. Okay, so now we're back at our financial report. So can we have a motion? For those of you who jumped on, Cherie already did the presentation of financials. Are you guys okay with that? Or do you
Yes.
need? Okay. So can we have a motion to approve or to accept the financial report?
Laura, so moved.
In a
Brett,
second.
I'll second.
Thank you. Can we have a roll call vote, please?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Candace Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Jerger,
Approve.
Sue Kraus,
Approved.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approved.
Okay, motion carried. Review and approval of department expenditures. So the department expenditures were in your packet. Can we have a motion to pay the bills, please?
Brett, I'll make the motion.
Thank you, Brett. And a second.
Laura, a second. I'll second Laura.
Okay, thank you. Can we get a roll call vote?
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Candace Clevenger,
Approved.
Jan Hack,
Approve.
Dr. Jurger,
Approve.
Sue Kraus,
Approved.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
All right, motion carried. Thank you. Brandy, do we have any grant applications for review?
We do not.
All right, great. Did department division reports were also in your packet? Does anyone have any questions for Brandy or for staff about those?
If there aren't any questions, I would like to highlight just a few things, if that's okay.
Sure.
Hopefully you've gotten to read through all of those because there is so much going on in every division, and I may not even be picking the things that the directors wish that I would highlight, but I did want to just give a few highlights and also make a few introductions. So in administration, as you know, we've been bringing on that new accounting software. We also implemented using that software as our new time clock to address the audit requests that we have minute-to-minute recording of what programs and services people are working in. So that's been implemented, and the admin team's been working very hard to ensure that everyone knows how to use that and that all of the little tweaks and things have been worked out. So not the best time to implement a new time clock. That's never a fun experience, but they've done a great job, and our team is learning it and getting more used to it. I did also want to say, like human resources wise, that we have onboarded some more employees for some open positions, and also board members. If you know of anyone looking for positions, we do have some open, so have them check out our website. If you recall, before COVID was a thing, we also talked about using some of our health funds to complete a salary assessment to ensure that even after all of those raises that had been given, that we do have comparable salaries for our staff, and we do have competitive pay. So Bethany has started working on actually bringing all of that together to have one cohesive document that we can use for budget planning. Clinical nursing, of course, they've been providing all of their regular services minus that STI clinic, which we are looking at when we could be able to do something with that again, with everything else going on down there. They also have been doing COVID vaccinations, of course. Demand has slowed, which you all have probably seen that and or heard that. And for several weeks, or even a month now, actually, the team has been getting very creative in their outreach and taking the vaccines on the road. They've been to many different churches. They've been to senior high rises. We have a nurse that's going and taking care of some of our homebound clients through Starting Point, through medication management, and they're doing some other community sites as well. We also, nursing partnered with the Office of Minority Health and Wellness from IDPH to bring a type of mobile vaccination site here to Macon County. So we did that as well. So very excited and proud of the staff for coordinating all of that and trying to bring vaccine out to people and make it as accessible as possible. I did also want to introduce Rachel Deerwester, who is on here. Shannon resigned for another position. If you remember Shannon, that was the director of nursing after Carol retired, and now Rachel has taken on that position, and she and Amber, the assistant director, have certainly hit the ground running and are doing a great job to move our clinical nursing division forward and think of some new ideas. One of the things that we are doing is starting a nurse education coordinator role. So it'll be another coordinator in the division, which we already had, but a new vision with that to ensure that staff have a constant training resource, that we have someone looking at quality improvement and everything like that, and so much more. So I really liked that idea, and I'm excited. We have that job posted now. And Rachel, did you want to say hi?
Hi, nice to meet everyone. I'm excited to be a part of the team.
Hi, Rachel, welcome.
And Rachel was on our team as the infectious disease coordinator, and she had come on, I can't remember exactly what month it was, but during COVID basically, and now has this new role. Dental made a big change there. We have started doing walk-ins for adults to try to be able to serve even more patients coming into our building. And we do have another contractual dentist that the team in dental and admin worked hard to bring on. So that's exciting, because if our dentist needs to be out or has a conference or a meeting or anything like that, then we do have another contractual dentist to help cover to ensure that we're still able to provide services on those days. Health promotion, of course, they're still doing those daily releases for COVID-19. They also are being extended for their funding for the teen pregnancy prevention and STI prevention project, which does take a lot of their time during the school year, and they're still providing that virtually to the schools. Environmental health and emergency preparedness, of course, they've been busy getting their food establishment inspections done. They're actually ahead of schedule despite not being fully staffed. And so they are in the process of interviewing for another environmental health specialist. And of course, emergency preparedness has been very involved with helping plan the mass vaccination clinics and follow up on a lot of the vaccine related needs on the emergency preparedness side. Starting Point, in addition to all of the regular services that they provide, they have also been instrumental in helping their clients get signed up for vaccination appointments, which has been really great for people that can't, necessarily get on the computer and make their appointments. We do have, if you recall, that vaccine operator line. So that has been instrumental and wonderful, and the people have been very thankful for that. But with Starting Point, they've been able to help proactively reach out to their clients. And like I said, we're also sending a nurse out to take care of some of their homebound clients. And then WIC, big thing that happened with them recently is they did have a review with no findings, and the reviewers sent me a very complimentary email about Karen and Lindsay and their team being very organized and really great to work with throughout that entire audit process, which was pretty extensive. And then also, I just wanted to let you all know, we've talked for a while with the COVID grant that we had gotten permission to hire for the Health Equity, Diversity, and Inclusion Coordinator role. So we did get someone hired for that. She has started and has already been very involved in getting a lot of things going as far as a plan for the health department and an assessment of where we are, where we need to be, and how we will get there. So really excited to have her on board as well. So does anyone have any questions about any of that? Or directors, is there anything I missed that you really want to point out to the board tonight? And a big thank you to the team. Everybody, as usual, has been working really hard. Unfortunately, COVID expectations have not really dwindled away very much. I really hoped by now they would, but now that we're seeing things be getting a little busier and we are pulling people from throughout the building to sometimes help with the mass vaccination clinics, there's still quite a big expectation. One other thing we have done is try to encourage our staff to seek any kind of mental health resources they can. We did partner with Macon County Mental Health Board. They have a CISM session that they can offer to first responders following a traumatic event. And so we have offered that to staff. I've heard from several that participated that thought that was beneficial. So if any of you ever have any other ideas of things that you think we should offer our staff to support them, I would definitely be open to that, because this is a struggle. I know that we just recently got a survey from IDPH that came out from CDC about the impact on healthcare workers of this pandemic and how severely it has impacted everyone, including healthcare workers. So if you have any ideas for me, please let me know or reach out to me privately, because we do want to make sure that our staff are safe, healthy, and well through this too. So that's all I have for that part.
Thank you, Brandy. And thank you and Bethany and all of the staff for all the great work you guys are doing.
Thank you.
Now we have employee recognition. The April anniversaries are Kathy Wade, 17 years, Betty Pritchett, 16 years, Nikki McKeith, 7 years, and Brian Wood, 5 years. Thank you to all the staff for their service. Old business.
Okay, so the first thing is the Board of Health member appointment update. So if you all had seen, I sent an email right before the April county board meeting that, I had seen an update on the agenda basically of who was going to be reappointed to our board and who was expected not to. I did communicate with those board members directly as well. In case you didn't see the email, what was on the agenda, which is what I had found out and how, is that Phil, Candy, and Dr. Miniganti were going to be reappointed, and that Paige and Mary Jane were not. And so then that night that I got to the meeting, they were all 5 people were pulled off the agenda. And I guess I should also mention the people that were proposed to be added were Debbie Hill and Mark Scranton, and those were proposed by the chairman. And so then during the meeting, all 5 of those appointments were pulled off of the agenda. When I inquired why, I was just told that there was a problem with one, and he didn't want to embarrass the one, so he pulled them all. So that was what I was told. So I just asked if and when he had, an answer to that or more information, if he could let me know, because I do like, as you all know, that I brought on, or that, the board's come on while I've been administrator. I like to give a packet in advance. I like to be able to tell the person what they're getting into and what the commitment looks like, and answer any questions and get them up to speed so that they don't feel like the brand new person with no information in the room. So I haven't heard anything yet, and I may not until, before the board meeting, which that agenda should go out May 4th. But I'm not sure if, the three, Phil, Candy, and Dr. Miniganti, will still be on there, or if there will be other changes to that. I don't know if Paige and or Mary Jane may now be kept. I'm not sure about that. And again, I probably won't know until May 4th. So I just wanted to let you all know. And I figured all of this might be a little confusing in email, and we were close to the board meeting anyway. So I thought I would just explain this evening. I also wanted to clarify, I did look up the resolutions under which you all were appointed. And they expire May 31st. So even if any of the 5 are basically not chosen to be reappointed, you still will be part of the board at the May board meeting. I thought that it was only April, and that went into effect immediately after the May board meeting. So that's on me. I apologize for that error. But you would be on the board. Your term would expire May 31st. And I mean, maybe you'll all be kept. I don't know. But I just want everybody to know what the update was with that. Any questions about that?
Okay. No virtual meeting.
Question, I didn't understand what you said. The people that he wanted to bring on, there was a problem with, or what was the problem?
He just said there was a problem with one of the 5.
Of the ones that are already on?
Well, of the 5, the 5 that were on the agenda were Phil, Candy, Dr. Miniganti, and then the 2 new people, Debbie Hill and Mark Scranton.
Oh, okay. And there was a problem with one of those.
Yeah, he just said one of the 5. So I don't know anything else specifically about that. And I just asked him to let me know once he knows more. I'm sorry that I can't tell any of you more. And I know that we talked about, he made the point about having, new people and fresh perspectives. I mean, I want you all to know, especially if any of you aren't chosen for reappointment, that I appreciate you more than I could tell you, because this has been an unreal, now over a year. And if you all hadn't been as supportive and just kind and positive as you had been, I don't know how I or my team could have made it through it. So I'm very grateful. I hope you all can stay on. But if that's out of our hands and you all can't, just know that I will be forever grateful. And I know my team, especially the directors, when they get on this call, they're all very thankful for the way that you all treat us and support us in what we do. So thank you.
You all are awesome. You really are. You have a great staff, and I can't imagine the workload you've had is unbelievable. You've done a great job. And the persons that have to every night calculate all those things and prepare it to send out every day, I know that takes a lot of time. Incredible time. And maybe they want new ideas because I'm old.
No.
What do I say?
You all are amazing and bring a lot to this board, and we're really grateful for you. So thank you for, like I said, the kind words and the support. And that just means everything, especially the way things have been so up and down. And, we've talked about the negativity and the attacks and the accusations, things that aren't true that are thrown at the team. And when our team gets on here and hears the things that you all say and just knows that you have our back, that means a lot. So I'm very thankful for my team. I've known most of them for a very long time, and we were like family before, and now I just can't even really describe the bond. But them knowing that somebody else sees it too makes a difference, I think, and helps us keep going. So thank you. And that's all I have for the Board of Health.
Okay, the virtual balance update.
Yeah, so I just wanted you all to know, I did check into whether or not we're still, allowed to have the virtual meetings. I checked with Mike Baggett just to make sure I was sure. And then I know that the county did move to in-person only, I think effective April 1st, maybe. So I just wanted to triple check to make sure we were still compliant and everything. He did say that as long as there is still a disaster proclamation and the president, like the president or the authority, which is our president of the Board of Health, thinks that it is prudent to not have people, in the room gathering, that we can still do the virtual meeting. So there was an update to the executive order, April 2nd, says it's in effect for 30 days. So right now we're still good. I did check with Paige to make sure she was still good with having virtual, and she said yes. So that's why we went ahead with the virtual for this week. And then I think that as long as the situation is the way it is, especially with the numbers increasing and now there being variants, some that are more transmissible, that this will be a good idea as long as the president of the board is agreeable to that and as long as you all feel as if it works, but it's up to the board. So if you just know that that's the update and we're still allowed to do this, but if you have any questions or problems with it or anything, you can certainly bring those to me or to Paige or Vivian. And that's all I have with that, unless there's any questions about it.
Anyone have any questions? Okay, thank you.
Okay.
Now, the contract for childhood mental health counselor services for FY20.
Yeah, that wasn't a short one. So just as a reminder, last month we went over that contract and you all had told me that you approved it as long as there were no significant changes back from the state's attorney's office, since I had not yet heard back from him at the time of our meeting. I did want you to know he did reply and there were no suggested changes. So I went ahead and put it through the county board process. I just wanted to circle back with you all to let you know about that. That's it on that one.
Thank you. New business, discussion and approval regarding live stream.
So that one, and I didn't know if the board would want to vote on it, so I put an approval on there just so we would be allowed to vote if you wanted to, but it doesn't have to be a vote. I'll leave that, of course, to the discretion of the board, but just wanted to present a discussion and it can be continued next month. But as you all know, with the virtual meeting allowance, because of the disaster proclamation, we have been required to live stream our meetings, and our awesome IT team has figured out a wonderful way to do that. It's live on YouTube and then it's posted a recording of it immediately after the meeting. So very high tech, very transparent. My question, I guess, or just something for us all to be thinking about in case there isn't a renewal to the disaster proclamation is, do we want to continue to live stream even if and when we come back, you know, all in person together? Again, that does not have to be voted on tonight. I just wanted to present that conversation because I think that needs to be decided by the board. Our team will do whatever the board wants as far as continuing to live stream. Of course, we have, you know, we have everything that we need to be able to do that. I just wanted to see what the board thinks about doing it moving forward when we're back in person in regular operations.
Okay, is there any discussion from the board?
Sandy, Randy,
Hi, Dr. Miniganti.
hey, how are you?
I'm doing well. How are you?
Good, good. Hi, good evening, everybody. I think I would wait for another month and see how this surge moves on and how the variants are. So I wouldn't make any commitments right now, but we had to wait and see what happens in the next couple of months to see what our cases are before we switch to an open meeting, you know, or a in-person meeting, sorry.
Yes, I completely agree with that. And I am fully supportive of not having in-person meetings until disaster proclamation is over. And we kind of are in a place where we feel really comfortable doing that. And I will tell you, even, you know, our staff here, we're doing teams, we're everything that we can do to ensure that there's not that unnecessary gathering. So I definitely agree with that. I guess what I'm looking for more is, do we want to continue to live stream the meetings when we're no longer virtual? And maybe I'm prematurely asking this, so, but maybe I just wanted you all to be thinking about it. So when we're confronted with this, it's not like a last minute decision that Brandy makes, but something that I'm doing reflective of the board's wants.
Okay.
I think it's a good idea to keep live stream even when we can be back in person, just because I think, you know, I think we've all seen how you guys can be unfairly attacked. And so I think just having that recording that anybody can watch that has exactly what's been said, you know, available is just, I think it's just a good thing to have. So if it's not too much of a hassle for you guys on your end, I would err, you know, I think it's better to err on the side of more transparency than less.
Mm-hmm. Right.
Anyone else? Okay, thank you. We'll move on to nominating committee attendance review report.
Okay, and that would just be, is the nominating committee prepared to make a report on the attendance review this month?
I can comment on it. I guess I didn't check in with the rest of the committee so they can disagree, but I looked at the attendance report, and so I think it looks good to continue with who we have on the board.
Okay. Any questions from anyone? Or comments? All right, thank you, Laura.
Right.
Review and approval of iPlan organizational capacity assessment.
Okay, so as you all know, we've been working through our iPlan process. Health Promotion wrote that document that you all reviewed. It was sent to the state for review. This particular section is just something that we do internally to ensure that we're doing everything we are supposed to. And so Bethany and I actually did that. It's probably been a month or two ago now that we did all of that review, got the document all ready to go. That is not something that we turn into the state. We just have to complete the process and then also, you know, inform our board, give the board the opportunity to review that document, and then also vote to approve it so that once our entire iPlan is ready, when the board president signs off and says, we've reviewed this and the health department staff did it and we're submitting for application, that you all can say they did the iPlan and they also did the assessment. So any questions that anyone has about that somewhat lengthy document, I'm happy to answer. And if there are no questions, we really just have to have approval of that document.
Are there any questions? Okay.
I move that we approve.
Thank you.
I second. Ms. Candy.
Okay, thank you. Roll call vote, please.
Vivian Goodman,
Approve.
Mary Jane Linton,
Approved.
Candace Clevenger,
Approved.
Jan Hack,
Jan, if you're talking, we can't hear you. I think Sandy, you can go
Jan,
on. Oh, there's Jan.
there you go. Okay.
Okay.
Dr.
Can you hear me now?
Yes.
Okay.
Dr. Jerger,
Approve.
Sue Kraus,
Approved.
Dr. Menenganti,
Approved.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
All right, thank you. Motion carried. Paid parental leave policy, Brandy.
Okay, so this is actually a new policy that we are proposing to have adopted. I'm trying to pop it up on my screen. So I will tell you all, this is a policy that the rest of the county does not have. So we would, to my knowledge, we would be the only ones in the county, but we were informed, you know, we asked legal quite some time ago just about policies in general, that we can have our own policies, even if the rest of the county did not, you know, adopt them or have them. And so just wanted to let you all know that, so you have a little bit of background. And we did submit this to legal for review prior to to Taisha Nelson, and I'm not sure if I gave her name earlier, so I apologize, but Taisha is who we hired to be the Health Equity, Diversity, and Inclusion Coordinator, and we are having her review all of our policies. So this was submitted to legal before she was here, so I'm still going to have her do one last just review of it to ensure that we're being inclusive of all parental or guardian situations, so that anyone that should be eligible is. But we'd like to present this to you for approval, and you will notice there are some yellow highlights on it. Here's the reasoning behind that. So right now we do not have any paid parental leave. Right now, people can use their benefit time. We also have IMRF short-term disability for the parent giving birth. And so people can take time off. Of course, they're also eligible for FMLA. They are allowed to go on unpaid time if they want to. They're not punished for that. And then they do have the ability to apply for a leave of absence if and when they use all of their 12 weeks of FMLA. What we want to do is be progressive and I don't even want to say progressive because it's not. People should have parental leave, period. That should just be a basic thing, I think, but maybe progressive and moving the health department forward is what I should say in better wording there. And so we were going back and forth about how many weeks should we make it, to go from 0 weeks to, X amount of weeks, I don't know. So one of the things we talked about was, just starting with 2 weeks because this is parental leave. So this would be, any of the parents that would qualify, not just the parent giving birth. And so, we talked a little bit about it being 2 weeks just as something, because right now we're at 0. We're starting with nothing other than their regular benefit time. Of course, we don't want people to be coming back or feeling like they need to in 2 weeks. So they would still be able to use their own time. They would still be able to apply for IMRF short-term disability. This would be on top of everything else. This would be an additional benefit. So this is not something where we're trying to get people to hurry up and come back after they're off for 2 weeks. It's just something we're trying to do in addition to them using all of their sick or vacation time or personal time. So we went back and forth and had several conversations about how many weeks do we give, what does the cost look like of a policy like this newly implemented, and thought maybe we should bring that to the board and get your guidance on where you think we should go with that number. Bethany did a lot of research to try to find, what is it usually at different places, or what's the most common, amount of weeks. And she couldn't really find a lot that was super definitive or that would be very, very comparable, to a local health department. And so, again, we were just talking through different things. As far as the financial impact, the only thing that we can really see financially is if you have a situation where instead of using 2 weeks of vacation, that person uses 2 weeks of paid parental leave, and then they have 2 weeks of vacation and end up resigning right after, and we have to pay out their vacation. Mm-hmm. That can happen anyway if someone resigns. And as you can see in the policy, there are, criteria that have to be met in order for someone to be eligible. And usually if we do have someone, resign specifically after they've given birth and they decide to maybe stay home with their little one, it's usually after they've taken the entire leave and then they make that decision that they would like to, discontinue employment so that they can stay home. So by then, most of the time, a lot of people are on unpaid time. So in that case, we wouldn't really see a financial impact to the health department. So I guess just opening for discussion of if anybody has any really strong feelings about numbers of weeks or things that you've seen or how you feel about this policy. We would really like to approve it for our staff, but again, I just want some input on that number of weeks piece.
Anyone have comments?
It's 12 weeks for the person that gave birth and then 2 weeks for any other parental person.
Well, so everyone, well, not everyone, but most of our staff, once they meet eligibility, they can take 12 weeks of FMLA for qualifying situations. So they would still get like their total 12 weeks. This would be paid time off. And the way that our policy works is that you take your benefit time concurrently with your FMLA. So for example, we may have someone, whether it's the person that gives birth or the supporting parent, that takes 2 weeks right after birth. Okay. It's 2 weeks of vacation or 2 weeks of sick time, but it's also 2 weeks into their FMLA. So then they'd still be approved of up to 12 weeks to be off. And then, like I said, we have leaves of absence. So if someone needed to be off longer because maybe they had some health complications or something where they needed more time, we have a process for that as well. We're not ever, in a big hurry to get rid of someone because they need time off because of a health condition or a child being born or adopted or something. But yeah, this particular policy would be 2 weeks for any of the parents that are defined in those bullet points, and it would be paid. So that they wouldn't have to get into all their vacation time or use up all of their sick time. Does that make sense? And then the disability that we talked about, that would be, for the parent, the birthing parent. So for example, IMRF short-term disability usually kicks in, or not usually, it kicks in after the 30th day. So usually it's like 2 weeks paid, but it's at a partial pay. So you don't get your full salary. And then let's say you have a more complicated birth and you might get 4 weeks paid after the 30 days. But again, that's only partial pay, and not everyone can afford to do that, but it is a benefit that we do have for people that qualify, and that's through the county. So this would be in addition to all of that. And then would also give, if you're a supporting parent that didn't actually give birth, it would give you parental time off as well.
Any more discussion? Not, would anyone like to make a recommendation?
I think this is a great idea, but I guess I don't really know what a good number of weeks would be. So, I mean, if the 2 weeks that you're saying makes sense, that's I think that would be fine. I mean, I think it's good to have, definitely good to have this policy though.
I do as well, and I don't know what the usual is for the amount of time either. I thought it was like 12 weeks, but I don't know really. It's been a long time ago for me.
Well, and I think it's so across the board because it really, I think, depends too a lot on a company or the culture of the company or what they can afford to do as far as how many weeks they're giving. So, obviously you want to try to at least, have someone, especially the birthing parent, be able to be off for at least 6 weeks. Unless they want to come back sooner, which sometimes, we have parents that do want to come back sooner and get an approval from their doctor. We have a lot of birthing parents that do take the full 12 weeks, and that's fine. They use their benefit time, they use the IMRF disability, they might go on a little bit of unpaid time. And, we certainly, especially being public health, want to support parents being, with their children, the birthing parent having the opportunity to heal and have that bonding time with their child as well. Or if it's an adoption, obviously bonding time is very important there too. So we know that 2 weeks, if we go 2 weeks, we don't expect anyone to come back in 2 weeks. And I can tell you 2 weeks is not an adequate amount of time after you have or adopt a child to just be like, okay, this is wrapped up. So that's not what we would want to imply either. But to be a local health department to adopt such a new policy, something that's not done across the board everywhere, we were like, what's 2 weeks is too little of time for someone to be off. So this would just be like, we're going to give you paid 2 weeks, but then you would also be able to use all these other kinds of time to be off for your full 12 weeks or whatever that parent chooses. So this, when we say 2 weeks, we're not saying we think 2 weeks is enough time, for a parent or parents. We're just saying we're going to give you 2 paid because we haven't done that before and we want to and we need to. We talked about doing, 4 or 6 and we were having all these conversations, but also, there's a big difference of having 0 and going all the way to 6 or to 4. And so these are kind of the conversations that we were having and going back and forth. Even 12 weeks, is not necessarily enough time when you have a brand new baby or you've newly adopted a child. And so hopefully someday, eventually we'll get to where it's even better in our country. But we're trying to get moving in the right direction and step toward the right direction for the health department staff.
Brandy, I really don't know very many organizations that are actually doing the paid leave yet. In the United States, I know it is, but here you have the FMLA where you take that and then you have to use your time. So the only thing I would caution is that you are offering a benefit to this group of people, but you are not offering to other people.
Mm-hmm.
So, you are setting up a disparity there between the only people who get these extra 2 weeks are people who have babies. So I just,
Mm-hmm.
I think that's one of the reasons it hasn't gone full force in the United States.
Right. And I definitely understand that concern as well. Another thing that was brought up when we spoke to legal about it was, that obviously we've also had parents who didn't get this. And, we understand there might be some frustration if we adopt it. but also, as we move forward, that's going to happen, in life, unfortunately. And we do want to try to, fight to move things forward. But I do understand. So if the board has that concern, happy to go through that more with legal as well and bring something back to you. If you'd like a specific, response from them on that, I'm happy to do that, because that's not something specifically that I talked to the attorney about as far as like the disparity in a benefit.
I didn't hear, my computer was reverberating, I guess, and I didn't hear clearly what Candy had asked or stated about the disparity.
I can say I didn't know if Candy would speak up again, didn't want to speak over her. She just said that, go ahead, Candy.
No, I think I just echo too much. So,
Yeah, it was echoing. You're good now.
I just said that you've got one class of people that you're given a benefit that other people are not entitled to, by setting this up like that. It's commonplace. It's more common for people to get a lot of leave time in other countries, where the United States has been behind in that. And I see where the United States is going with that, but it's not like, I don't actually know of another agency that does anything except for filling medical leave and letting, the husband and the wife take their 12 weeks and they have to figure out how to get it paid for. And I know that if we do this, we'll be one of the early adopters, and that would be a good thing. But I just want to make sure we do it with, a clear idea that we're, doing it to a certain segment of the population.
That makes sense. So would you guys like Brandy to go back to legal and discuss that with them? Or are you ready to vote on it? We have a recommendation of 2 weeks, so. No one?
Well, if the legal saw that was not a good thing, would they bring that up without you asking?
Probably, but also, I can't guarantee that, so I don't want to necessarily say like yes for sure, So I think that, if that's definitely a concern, I'm happy to bring it back to Ed Flynn. He does the human resources legal consultation for us and review. I'm happy to bring it to him. Like I said, the concern that he brought up was about just previous people that had not gotten this benefit that were in the same situation. And so that was the only thing brought up at that time. But I mean, I'm more than happy to do what the board wants. I want, you all are the ones voting. And if this ends up being something that's controversial, especially because of the county and the, one department doing it and not all or something, then, I'm more than happy to do whatever you would like me to do just to ensure that we're moving forward 100% the right way.
Any more discussion?
Brandy,
Yes.
I'm not an expert on this, but I see Candy's point where the United States is way behind the rest of the world, or rest of Europe at least, in this leaves and all that associated with childbirth and all that. But I think we should have a legal form, something to back up, because my understanding is that the health department is the only one that's going to do it now.
Yes.
And not the county.
No.
So I think we had to have some legal backup here before we proceed further. Again, I'm not an expert on this, but I'm just going by what I think would be the right thing to do.
Okay, so is everyone okay with Brandy going back to legal and making sure we have all the bases covered?
Yeah.
Is there anything else that anyone wants me to specifically ask about other than the disparity concern?
This is Janet. I just have a question about, can an employee take sick time off if they need to take care of someone in their family who's ill? Did you say that earlier? I'm sorry if I missed it.
Oh, no, you're okay. I didn't go into detail about it. Yes, our sick time policy is very, I can't think of the word off the top of my head now. Very, very inclusive. So it's not only if they're taking care of someone that's sick, but if they are taking someone to an appointment, that would also qualify. And we do define several different family members in that policy, and then also put anyone filling those roles to all intents and purposes, because we know that not everybody's family has these exact definitions and things like that. So we do try to make that as inclusive as possible so that people can take care of themselves and others, not only when they're sick, but if they need to do appointments, whether those are prevention or treatment related appointments, and all of those would be allowed for sick time.
Okay.
Okay. Any other questions? Okay, Brandy, so you want to take that back to legal and
I will.
make sure that we have everything in place and then bring it back and we can vote on it?
Absolutely.
Okay. Thank you, everyone. Is there anything else? I don't see a closed session.
There's no closed session. I did, if it's okay, Vivian, and with the board, I did just want to we were going to do board appreciation. I know we talked a little bit about this earlier. Before COVID, Bethany and I had this plan of like April was going to be Board of Health Month, and we would try to do something nice for you all coming to show you our appreciation for everything that you do for us. So I'm sorry that we can't have delicious Board of Health popcorn is what we call it, and the snacks and the all of that here, and have you here together. But we did just want to take a second just to specifically say thank you. We know this is your time. We know this is the for some of you part of your workday or the end of your workday, or taking away from time with your family or your friends or your personal time. So thank you for sticking with us and for your commitment and time. And like I said earlier, your support really means the world to us. So thank you. And eventually we'll get to gather and bring snacks and all that fun stuff. So that's all we wanted to say, was just thank you for being there for us, and thank you for committing and following through on your commitment to us and the health department. And that's all we have other than adjournment.
All right, so I will entertain a motion to adjourn.
So moved.
Brett, second.
Thank you. Roll call vote, please.
Vivian Goodman,
Approved.
Mary Jane Linton,
Approved.
Candace Clevenger,
Approved.
Jan Hack,
Approved.
Dr. Jerger,
Approved.
Sue Kraus,
Approved.
Dr. Meningati,
Approved.
Dr. Patterson,
Approve.
and Laura Zimmerman.
Approve.
All right. Thank you, everyone, and thank you for your patience with me.
You're wonderful. Thank you all.